Hey everybody, it's Dr. Galvin with today's update on the coronavirus. I'm wearing a really cool mask that a friend of mine honestly, I think Marnie and I may have met each other in kindergarten. Marnie Peck and her daughter Ella made us about 20 of these really great, comfortable homemade masks, which I'm going to take and distribute to the emergency department. Thank you very much, Ella. Thank you, Marnie. This is great. Thanks. Numbers today, 777,000 cases worldwide. I think we're at 37,000 deaths, 160,000 cases in the US, with just at about 3,000 deaths. Remember, was it Friday? There were 80,000 cases in the US, and so it's doubled in essentially 3 days, which is what we've been kind of predicting, right? We expect those numbers to sort of double every 2 to 3 days unless we can get the replication of this virus under control. You can see what's happening in New York. You can see what's starting to happen in Detroit, in New Orleans, and everywhere else. So I worked this weekend in the emergency department. I know everybody wants to kind of know what's going on. And, you know, honestly, where I am at here in North Carolina near Charlotte, it seems like things are ramping up, but they're ramping up at a relatively, reasonable pace. We're not being overwhelmed. Volumes of other things in the emergency department are down. We are seeing more and more COVID cases. I was on the phone with one of my colleagues regionally, and he told me that the COVID unit at their hospital was full, and they were actually going to be transferring some patients to my hospital. So we are starting to see more hospitalized patients. I did not see an onslaught or a crush of ventilator requiring very, very sick patients, but we probably think, at least locally, that our peak is not going to be for several weeks yet. The social distancing may slow that down even more. So if we can get that R naught down and we can reduce the transmission, we're going to do a lot better. Unfortunately, I still see lots of people out and about. Stores seem to be loaded with people. I hope that people are taking the precautions to wash their hands, to separate from each other. I think it's incredibly important. We're in this for the long haul. Trump just extended the restrictions till the end of the month, or end of next month rather. I think that everybody has to start getting in their head that this is not going to be over next week. This is probably going to be 4 to 8 weeks longer where we're really, really locked down. And then what may happen is we may release or reduce restrictions, and we may see another spike, and it may have to be re-implemented. So I was thinking a lot, partially I think when I was asleep I was thinking about this. I have this update with you guys every day, and I know quite a few people watch it, and I try to provide a pretty level, balanced view of what's going on. But my other life, I'm a wellness physician, so I think what I'm going to do this week is I'm going to continue to do the daily coronavirus updates, but I'm also going to do a couple secondary videos during the week that really focuses on wellness and how do we stay well, stay healthy, both physically, mentally, emotionally during this crisis. Because, I think all of us are starting to go a little stir crazy, right? We're home, we're with our families, which is a good thing, but we're with our families, which can sometimes be a bad thing too, right? And, nerves can get frayed, especially if you're in tight spaces. Today I've been trying to get my wife's office set up because, we haven't been physically seeing live patients in our office. We've been doing everything telehealth, and at this point we decided to move it to the house. And so I've got a big, honey-do list in terms of getting her office sort of set up because my wife runs the majority of the clinic for me. Lots of questions about chloroquine, about azithromycin. I know there's a lot of internet memes going out there about, this doctor here who cured all these people. We don't really know. We know that we are using those drugs in protocol at the hospital. If someone comes down with COVID, would I recommend you taking them? Yeah, I think there's certainly no evidence that they're harmful. Access to those medicines may be an issue, but there's certainly no evidence at this point that it's a cure. And I keep getting people sending me messages from Dr. Oz says it's a cure. Well, I'm sorry, Dr. Oz can sometimes be not the brightest bulb on the Christmas tree, and he'll go wherever the winds blow him. We don't have definitive answers yet about that. We don't have definitive answers about remdesivir or some of the HIV drugs that are being trialed. We're trying different things because at this point we just don't know. What do we know? We know we can avoid getting it if we follow the guidelines we've been talking about. Separation, wash your hands, do all those things that we continue to talk about. you can see those numbers in Italy, you can see the numbers in Spain kind of going up and up and up, and they're at a breaking point. Governor Cuomo is calling, they're thinking that they're going to hit disaster area, a level of cases in the next week or two. And I'm hearing that from my friends who work in New York City. Cuomo's put a call out to doctors to go up there. I don't know what the mechanics of that, their licensing requirements and things like that, how easy that is to actually do. That being said, we have to do what we can do locally, and we have to do what we can do in our own homes in order to survive this. So yes, it's scary to see these big numbers, but realize that what we can control is what is directly in front of us and directly around us. And those are the things that you have control over. And so there's no use getting anxious about things that are out of your control. Focus on the things you can control on. Focus on getting good sleep, on eating right, on exercising, on developing connections with those around you, be it live with the people in your home. When that becomes unbearable or just you need a break from that, get on Skype or get on Zoom or something like that and reach out to people virtually. If you've got a neighbor, talk to them, but keep that distance. I talked to my neighbor who's an oncologist, and we were conspicuously about 8-10 feet apart, kind of yelling to each other, because neither one of us wants to expose our patients to anything. And me, I'm kind of a danger, right? If I'm an ER doctor, and if anybody's going to get it, it's going to be me. Every time I go in there, I kind of have this discussion with myself. Am I going to quarantine? And I'm basing that on whether or not I feel like I've got enough personal protective gear and that I can protect myself and my family from an exposure. And so far, blessedly, I've been able to say yes. I have not felt that I've had an exposure that is worrisome. I've had full gear that I need for every patient I've had, especially for those ones that I'm suspicious. Unfortunately, our hospital system still has a 7 or 8 day turnaround for the COVID testing, so I never know whether somebody I admit has got it or not for at least a week. The other system in town has got a couple hour test, and I'm referring people, go to the other system if you want to know, because you're not going to be satisfied with our system. But I've been assured that this new, this fast test was going to come out Friday. Or maybe next Friday. Who knows? It hasn't come out yet. We know it's coming. There are news reports of a 5-minute test and a 15-minute test. I think the testing piece, we got a lot of innovative people in the country, and they are going to be able to innovate our way through the testing piece of it. I'm going to stop here. Again, I'm going to be posting some secondary videos that are really focused on health and wellness during this crisis. So I will label them differently. So if you're not interested in hearing me go on about how to be healthy and you just want the coronavirus update, I'll clearly label them. Please understand, I'm not a social media guru by any chance. I really need some help. If anybody out there knows somebody who's good at this stuff, because I've got people who want me to post it to YouTube and to Instagram, and I forget, and editing the videos and everything else. It's basically me that's doing it. But anyway, bear with me. I'm trying to get things out as well as possible. Leave questions below. We will do a Facebook Live towards the end of the week, or unless something really major changes. Take a deep breath. Don't panic. We're going to get through this. Take care of yourselves. Take care of each other. Take care of those around you. Wash your hands, and we will survive this. I will talk to you tomorrow.